Do you have pain throughout the day and you're managing your life, going to work, doing your housework, and you're managing it, it's going well. But now when the sun sets, you're trying to sleep, hey, you suddenly feel more pain at night. You wonder what's happening. Why do I always feel my pain increases after the sun goes down? My name is Dr. Roshan and I'm a pain consultant here at Alleviate. And today I'm here to tell you some surprising facts about why patients feel more pain in the night. Now, any chronic pain which happens over any pain which lasts for more than 3 months, there are certain chemical changes which happen in the brain. Stress hormones like your cortisol, noradrenaline tend to go up, and your good hormones which tend to fight pain and brings about joy like your oxytocin, endorphin, serotonin tends to go down. What that means is you'll always be in a fight or flight mode. You'll always be in a constant stressful mode. Now your brain has basically two main centers which processes pain, that is mainly the somatosensory cortex. Whenever the signal reaches this part of the brain, patient feels pain. Now during the day you'll be performing a lot of activities, be it at office or at home, you're talking to people. That's when your frontal cortex, that's the executive mode as we say, that tends to be active throughout the day. When that is active, generally the pain pathways tend to be less active. Now when all the work is done and you're winding up at home, what happens is now you stop performing the executive task, you stop performing certain other works, etc. You stop talking. Now you're trying to sleep. Now that executive mode or the executive network or your prefrontal cortex tends to be quiet. Now what will be hyperactive is your pain part. So what that means is it is the same pain throughout the day, but when you're trying to sleep, you tend to feel, oh, I think I have more pain. It's not actually. It's the same pain, but you're feeling it more at night. So this is a process of central sensitization. That's why in pain management, you always have to follow a biopsychosocial approach. You have some injury, yes, that's the biological bit, where we manage at pain clinics through injections and physiotherapy, etc. to improve the mobility. But it's also very important to also manage the psychological aspect of pain, because any patient with pain tends to have a lot of anxiety and stress. So emotional management, be it through doing adequate yoga, your breath work, your mindfulness techniques, listening to apps like calms your brain down before you sleep. Your sleep hygiene is extremely important because your body heals only when you have a good sleep. A lot of pain patients unfortunately have a very poor sleep quality and they wake up feeling tired, and that means the body is not healing adequately. So how you have to manage is, get your blue screens away at least 1 hour before you sleep, have very good anti-inflammatory diet and don't have late night snacks, etc. Have adequate water, and maybe 1 hour or half an hour before, do a little bit of breath work, taking deep breaths, or do a bit of a yoga stretches. Of course, in terms of extreme anxiety, we at the pain clinic, we also have pain psychologists, which will help you deal with any of the emotions which you're struggling with, be it anxiety or depression, etc. So only when you manage the emotional component of pain, and the pain physicians also manage the the physical components of pain. The physiotherapist will manage the muscular strength and the mobility aspects of pain. The dietitians will manage your weight loss. Only then will you have a truly breakthrough in your pain, and you'll slowly notice that your sleep gets better, your mood improves, and you feel less and less pain even in the night. So if you want to know about the true multidisciplinary team or biopsychosocial approach of pain, please do visit any of the Alleviate branches here at Bangalore.